Okay, all right. Welcome everybody to one of our last sessions of the day, our second panel. This one is on community health, and we've had some very gracious people agree to help us out with this one. So we really appreciate you all being here. So I designed this panel maybe as a way to harken back to my social work degree roots and some of the work I've done there. And in a way, working at Kansas Rural Center is like social work in a bit of a different way, a lot more community organizing. But at KRC, our mission is to promote the long-term health of the land and its people through research, education, and advocacy that advance an economically viable, ecologically sound, and socially just food and farming system. And I really feel like the folks on this panel and talking about the issues we're going to talk about today can really dig into some of the advocacy, education, and the socially just food and farming systems and systems in general. So I'm really excited to have you here. So thanks again. We'll just start with having you introduce yourselves. And I think, Keisha, you're going to go first. Can you say a little bit about your background, work experience, or other that you want to mention, and how you interact with community health?
Good afternoon, everyone. My name is Keisha McClish-Couch. I am the mental health specialist for Common Ground Producers and Growers. I am I have my master's degree in marriage and family therapy. And what else? I have been working in community health for about 7 years now. I just stepped out of ComCare Community Crisis Center. So I've been working in crisis for about 5 years. And I just decided to take a break just to get myself together to be able to help rural areas and connect with the community a little bit more than just working in agency work. I have been working with Common Ground Producers and Growers for 8 years. Started just being a driver and providing produce and getting the produce to the senior centers, and now stepping into more of a mental health aspect, providing support to our seniors, which are in the senior centers that we provide to. We have over 35 senior centers that we provide to. And we also have a group of seniors that we provide produce to monthly for free that live in food desert areas. So we provide fresh produce to them. We also connect with them as far as phone calls, welfare checks, things like that, just so they know that they have support in the system within the community, although they can't get to their grocery stores because they live in food deserts. And that's just a little bit about me.
Awesome, thank you. Martha, would you be willing to go next?
Yeah, first want to say that I'm really excited to be here and engage with all of you on this. I work with Kansas Appleseed, which is a statewide advocacy organization. We do a lot of legislative advocacy and policy advocacy. So for me, my background is actually in direct service. So I come from working as a domestic violence, human trafficking advocate. So that's most of my background concerning community health. And so it's been an interesting and valuable perspective coming into food insecurity. And I am primarily based in Southwest Kansas. So as part of Kansas Appleseed's Thriving campaign, I do a lot of statewide anti-hunger work, but most of my work is on the ground and in 5 counties in Southwest Kansas. So my partner and I live in Holcomb, Kansas, which is right next to Garden City. And we have family here, and his family has been working and owning a business in this community since the 1940s. So it's been interesting talking with community members and seeing how this area has changed and grown. And hunger is definitely a priority concern for a lot of community partners here. So for me, it's different doing advocacy work on a large scale. I'm used to working directly with impacted community members. And so not, meeting with community partners and food pantry members and not doing the work with them feels different. And a little weird for me, but and also this position has allowed me to engage in spaces like this and get so much more of a broader scale of experience and wisdom. I think it's important that Kansas Appleseed and the work I do always centers the experience and wisdom of local organizations like I used to work for when it was domestic violence and human trafficking. So yeah, that's a little bit of my background and just really excited.
Thank you, Martha. Erica?
Yeah, good afternoon, everyone. Very excited to be on this panel for this discussion. I am a program manager with the Kansas Healthy Food Initiative and the Rural Grocery Initiative. So I'm going to try to give a brief overview of both of those programs. So the Rural Grocery Initiative is housed within Kansas State Research and Extension. We've been around since 2007. And really our mission is to help sustain locally owned rural grocery stores. And we do that in a few different ways. So we provide technical assistance to both existing grocers as well as communities that want to open a new grocery store. And so technical assistance just means we're providing informational resources and different tools to set those projects up for success. We also conduct research on challenges and best practices for rural grocers. We host educational workshops and webinars. And all throughout this, we're trying to build connections between grocers so that they can learn from each other as well. And then the Kansas Healthy Food Initiative is a public-private partnership that aims to increase access to affordable, healthy food at the retail level. So that means we're not just working with grocery stores, but we're also working with mobile markets, farmers markets, producers who supply to retail outlets, and so on. So we work across the state, or I work across the state on both of those initiatives. KHFI works with both urban and rural communities, specifically in low resource and underserved areas. And KHFI also has a financing component. So we provide both loans and grants to various food access projects. And for both of those initiatives, we have a pretty expansive view of how those programs interact with community health. So we often talk about those initiatives as interacting with, obviously public health, but also economic health and community vitality. So I can kind of go into more detail about that later on.
Thank you, Erica. Finally, Kendra.
Yeah, that's great. I'm so excited to hear the other panelists here too and get their input on some of these issues. Seems like there's a lot of overlap here. My name is Kendra Davila and I work at Peace Connections. It's a small nonprofit in Newton, Kansas. We focus on helping build social connections in our community, kind of building up social capital. Part of me growing up, I enjoy spending time in the community and getting to know my neighbors. The job I have here at Peace Connections, it's as a community liaison. I was hired under a health equity grant with the Health Foundation to improve community health. And they left it pretty broad for what that looks like. So a big part of what I do every day is I get to meet people in the community, ask them how they live life here, what it looks like to access resources, to navigate different doctors and different things around our community. And so that's been a really good learning experience for me. Part of me growing up too, I grew up in Heston right after the tornado, and I was constantly surrounded by stories of neighbors coming to someone's aid to help rescue them, to offer a place to stay or a meal, whatever that looks like. And so my view of community is heavily influenced by that, and knowing how important it is to have that sense of place, a sense of purpose and where you are. And we'll explore that further here soon.
Wonderful. Thank you. So you all live in different places in Kansas, and this can either be about where you work primarily, where you live, however you want to take it. But what are some of the maybe location-specific challenges that the community you belong to is facing? Or if your work takes you across the state, what are the challenges that you see there? Obviously, Newton is maybe a little bit different than Holton versus Manhattan. So let's talk about some of the big challenges that your communities face. Keisha.
One thing that Wichita is facing right now is food desert areas. And majority of the food desert areas are in our lower income areas, where there is a higher population of your Black communities, your Hispanic communities, and things like that. So in the Wichita area, we are seeing an increase of food desert areas. And I believe Wichita is the biggest city in Kansas. So it's kind of surprising to me that we have such a large demographic or space that there are no grocery stores within like a 1 mile radius in some of the zip codes in Wichita, Kansas.
Thank you. Martha?
Did you say something?
Sorry.
Oh, sorry. If you wanted to go on, Keisha, I thought you, okay.
Oh, no, I didn't know if you had said something else. I'm sorry.
Oh, go ahead.
I was just taking forever to unmute Keisha. Yeah, this is kind of an interesting one. So Kansas Appleseed as an organization has been in Southwest Kansas and Western Kansas for about 4 years. It started out as just SNAP and food stamp outreach and assistance and working with summer food service programs. And working with organizations like K-State Research and Extension and school districts and churches. And then last year we did a lot around census work and voter engagement, civic engagement work. And so the hunger perspective is kind of coming back around and got this grant because it's such a priority. And it's a different community than I've ever worked in. I came from working in Southeast Kansas as a domestic violence advocate. So majority of this population is made up of immigrant communities, and a lot of them are not being counted on the census as well. So there is a really large population of people that are feeling erasure. And so food insecurity, I've just been in this job for a little over a month, and I've met with a lot of community partners in the counties I work in, and there's a consensus that these immigrant communities are feeling a lack of safety in their daily lives. And it's not just around food, but it is a lack of safety around accessing food, especially. So my hope is to continue meeting with community members and leaders and impacted community members as well, to let them direct how I move forward in this position. I feel like I'm learning that we can't address legislative barriers around the HOPE Act or SNAP benefits if these communities aren't even accessing these resources in the first place because there's no safety. So if members of the community and community leaders are stressing to me that and are sharing that there's a distrust of government agencies and a fear around public charge, then I think that my job in this community is more of amplifying that message to legislators, and then finding out what the current access to food is and making that the priority instead of doing what I think is best as someone who's not an impacted community member. Southwest Kansas has a lot of challenges and barriers and a lot of accountability, I think, that needs to happen to make it a safer community. And I think that's how you make food safer to access as well.
Thank you, Martha. I think that's really interesting already. safety versus proximity versus access to food. That's awesome. Thank you for bringing that up, Erica.
Yeah. So my community, since I work across the state, is very, very broad when I'm talking about the work that I do related to food access with the Rural Grocery Initiative and the Kansas Healthy Food Initiative. So I work in both rural places and urban places. And the issue of food access is one that is relevant to all communities, regardless of size or regardless of geography. So food access, I kind of wanted to go through some different language related to food access. And food access is very broad. It refers to the availability of food in an area, the affordability of food, if people have time, money, transportation, knowledge and equipment to prepare the food. And then we just heard from Martha that it's also related to, feeling safe and secure. So there's a lot that goes into food access. And because of that, the lack of food access has become known by several different names. So for instance, you have the term food insecurity, which is referring to a lack of financial resources, not having enough money to be able to consistently acquire food. Even if there is a grocery store nearby, you don't have the money, you can't access it, or the quality and variety of your diet is reduced because of that. Most of us have probably heard the term food deserts, which looks at both the poverty rate of an area as well as the proximity of grocery stores. So in urban areas, having to travel more than a mile is considered low access. In a rural area, having to travel more than 10 miles is considered low access. And though that definition was created by the USDA to classify low access areas. And if I were to show you a map of Kansas, showing you what the USDA considers to be low access, most of the state of Kansas would be shaded as low access. Then you have another term called food swamps. And this is getting at the idea that many people do live in areas with food, but in those areas, there's a much higher prevalence of unhealthy food compared to healthy options. And then there's another term called food apartheid, which is getting at this idea that, lack of food access is not a natural phenomenon. This comes down to economic and policy decisions. And that most of these communities that face issues with accessing food are low-income communities and communities of color. So I guess what I'm trying to say by laying out all of these terms is that this is a very nuanced issue, and that's why we see so much language behind it to describe this problem, and that these challenges really reach all communities, the majority of communities at least.
Thank you, Erica. Kendra?
Yeah, I'm so excited to add some language behind that too, maybe from a framework of social capital or what it looks like to have relationships in your neighborhood. When I talk about social capital, it's the measure of the connection we have to other people, other humans in our area. So how much we each have is directly responsible for our class mobility and our success in life. So the more you feel comfortable asking someone for a favor or asking your neighbor to borrow a cup of sugar, for instance, the more likely you are to get the things you want and need out of life. So what that looks like is if you are in a food desert, well, if you have a relationship with a neighbor who could drive you to a grocery store, that might increase your chances of getting access to food. It might be like borrowing a cup of sugar or something like that. Having those social relationships. I think we've seen that a lot in the pandemic, what that looked like when people were running out of toilet paper and their neighbors were offering theirs, or neighbors, offering to go grocery shopping for those who maybe were more hesitant to be out in crowds. So what those connections looked like, they were a lot easier to establish for people who already knew their neighbors before the pandemic, like before there was an emergency, those groups did better. And a lot of what that looked like, it was informal networks rather than some formal places like a food pantry where you have to go, on the first Wednesday of the month or something. It was just people helping their neighbors whenever they needed it, whatever that time was. And that's where I've been focusing a lot in this last year of how people informally access food. And one of those things that we found in our neighborhood was through little libraries. People started like the little free libraries that people would have on their street corners. It used to be just books, but we saw a lot of people starting to add food to them for their neighbors who couldn't get to the store, or sharing their toilet paper or hand sanitizer, whatever that was. So one of the things I did very quickly then was just to create a map of those little libraries or those little pantries for our community, to help people kind of figure out where there was food around, where they didn't have to be near other people. And I think that really helped people, maybe as a very informal way of fostering connection. I think that helped a lot. One other statistic that I think is just really interesting that kind of relates to this, and getting to know your neighbors and maybe borrowing things. I saw that the average drill, like the handheld drill, it's used for less than 13 minutes in its overall lifetime. So, if you borrow something from your neighbor, it might feel awkward because it might there's like a stigma about asking for help, right? You might feel vulnerable asking that. They might think less of you, but it really helps you to create a culture of sharing, this mutual aid, what that looks like there. And then obviously increasing the use of that drill helps, and then cutting down on environmental impact. I think that's really important then when we talk about food, what that looks like to be able to share things locally, but then also how that impacts your neighborhood. Because if you feel like you have a sense of place or a sense of purpose in your neighborhood, that kind of expands outward. And the more that you care about your neighbors and you invest in your neighborhood, the more that can grow into maybe greater policy or into government type things on a larger scale. So going from a micro scale to a macro scale. Yeah, that's a long way of saying that it's important to know people and in that food access.
Yeah, and the work that Peace Connections does also is a lot in that social capital, but to try and eliminate some of the social isolation that a lot of people face, right? So that that's a deficit, I guess, a poverty of relationship that some people experience that really makes it hard to achieve these other things they want. And so, yeah, it's great. Thank you. We might just pull that out a little bit more, and so I guess we talked in some more generalities of some of the challenges. What are the organizations, and I know some of you've answered this already a little bit, what are some of the organizations you're working for doing kind of like on the ground to address those challenges, or do you see other organizations in your community doing good work to challenge those things? And if we start with Keisha, I would be particularly interested in how mental health work plays into food access, especially with Common Ground, and how that relates for you. So,
Common Ground is doing quite a few things now since there has been an increase since the pandemic. We are a mobile market which provides fresh produce to those in the communities where there are desert areas. This past summer, we had partnered up with the county to receive teen workers that the county paid in order to have them have some type of work experience. So we had 4 individual young men come and assist us in the community with providing fresh produce to the senior centers. So that's one thing that we had done. We're connecting with Sedgwick County and doing that, and just giving an awareness to what's going on as far as that. Just to speak a little bit about the gentleman that did work with us, They were an awesome group of gentlemen. They learned what farming was and is, and the hard work behind farming, and where things come from, and how it's grown, and does it come off of a tree or does it come out of the ground? So just an awareness with that. There was also an awareness and an educational piece that they did not understand or know, the food deserts that were in the Sedgwick County area, and how many people are not getting fresh produce. And they also were educated on what things taste like when it's fresh and not cooked or processed, and things like that. So Common Ground, we're doing quite a few things with that. On the mental health piece, we did have a couple of the young men that had mental health struggles. So in that instance, that's where the mental health piece or my skill or training would step in and assist Common Ground as a company to have those young men still have that work ethic, but still be able to work within the struggle of their own mental health. And like I said, we're also working with the seniors to provide some support, welfare checks, telephone calls. Isolation has increased with the seniors during the pandemic and also after the pandemic. So just knowing, how are you doing? What is going on? Are you receiving your fresh produce? Is there anything that you need? Because when you eat good, you feel good. And when you feel good, you can do good. So just those, that cycle of eating healthy, feeling good about yourself. So we're working with those things. So I did not know that mental health would have connected me with food and Common Ground and the crisis and after the pandemic, and how it seems to be increasing with this next strand, the Delta. So it's just trying to navigate and see what the communities need as far as their mental health is concerned with food. And it is a connecting piece with food. So that's what we're doing. We're putting boots on the ground, and we're connecting with people, making phone calls, going to visit them, wearing masks, trying to be safe, social distancing, all of those things that now we have to do in order to service our communities. Never would have thought that it would be like this in 2021, but we have to continue to service our communities the best that we know how. And I think that's what we're all doing on this panel. That's what we're all trying to do.
Yeah. I just want to ask you a follow-up question. I'm sorry.
Yes.
From a producer perspective, either your family or other folks in the network, or even rural producers. I don't know how much you interact with folks doing field work. Especially with COVID, farming can be a pretty isolating thing in general, and then even more so maybe during COVID. Have you noticed anything or heard from people about that at all? Or
yes, I have, and I do have connections with the producers, and just with us as a family farm, because I'm a third generation farmer. So us as a family farm, things begin to slow down a little bit. With a couple of our producers that produced for restaurants, it slowed down in the restaurant area, but it increased for Common Ground. So with us not necessarily delivering to restaurants, we began to deliver more to individuals. So our individual population increased, while the big social aspect of the restaurants had decreased for our producers. So we began to help them more on the back end, because they needed to produce more for the individuals than they did for the restaurant business. Even as far as our farmers markets, during the pandemic, they had slowed down. So with that being said, those people that did travel to the farmers markets, our delivery system increased. So they were calling and they were making we were making deliveries, and they were requesting more produce because they couldn't make it to the farmers markets. So during the pandemic, it was excellent for us because we just masked up and we were the farmers market DoorDash. So it increased for us and also increased for our producers, which was good also in our farmers.
Right. Thank you. You're all doing amazing work. I really love it. So, let's see, Martha, I guess how does your work look kind of day to day on the ground? What is Kansas Appleseed doing to address the issues in the community you're working in?
Yeah, so I'm just in awe of the other panelists here. I've been writing notes too. It's pretty amazing work, and the way that they all intersect is just really fascinating right now. And I especially liked what Kendra, you talked on with social capital and going through it with the informal network, because that relates to a lot of what I'll be doing and amplifying in Southwest Kansas. So we released a hunger report a couple months ago, just an outlook of what hunger looks like and SNAP access looks like right now in Southwest Kansas. And what we saw is that, during the pandemic, access to SNAP did not increase with unemployment, which was a huge gap and a huge sign that these communities are not getting help from SNAP and from state resources. And so, in focus groups, we found out that it's exactly what you said, Kendra, that it's an informal network, in apartment complexes, in neighborhoods. People are starting their own little food pantries, or and the informality of them too, I think, keeps with the confidentiality side of it as well. And then in talking with the more organized food pantries in all of these counties, they're expanding their hours. They're trying to accommodate people because it's all really small town communities where everyone knows each other. And there's a lot of pride here in Southwest Kansas, and rightfully so, that if you're seen going to the food pantry, that means something in some way. So there's a lot of, I think for me, collaboration I can build among people who are running food pantries to not require some form of ID to access the food pantry, or require even participation in their program if it's a religious facility that's organizing the food pantry, and also offering more accessible hours. A lot of their hours are one day a week for a couple hours. That's during the workday, and Southwest Kansas is a 9 to 5 strict workday, and then people who work at the meat packing facilities and the plants are doing second shift and third shift. So kind of offering a variety of hours. And then also, that goes back to building safety, that there are some food pantries who have allowed people to come after hours when it's dark so that people aren't driving by and seeing them pick up this food. And then the whole other side of it is providing more culturally based food. There's a lot of food boxes that were distributed and returned because it contained food that people weren't familiar with. If we're working with immigrant communities, they're used to fresh produce, used to, some, better meals, and canned goods is not something that is accessible and was returned. And rightfully so. So helping these food pantries just kind of collaborate on everything they've learned so far, and maybe, bringing them all into one space. Our hope is to do some anti-hunger summits and bring people together to not only train on, SNAP applications, but bring this whole other level to it. I think what we saw with our numbers with, SNAP access not increasing with unemployment means that it's not being accessed. So, there's part of me that has to go with my grant and do some SNAP outreach. But for me, it is still pretty flexible. So I think most of our anti-hunger summits in Southwest Kansas will be focused around food pantries because that is the main access for food right now. And even the materials they hand out need to be accessible and have, different translations of the verbiage on there. Because we have communities from Guatemala and Mexico and Venezuela, and I think Thailand, Sudan, like there are so many different immigrant communities here that are all just as prevalent. And again, it's hard to bring this to legislatures because they depend on data so much. And the numbers aren't there where they're not, there's no safe way of getting a accurate count of these communities. And I think, and this is just something that I've realized, that the most accurate count is in the schools. So there's a lot of safety for kids who, are in these families that are in school and they're accessing universal free meals. There's no barriers to the summer food service program for them. And what we're seeing in these rural communities is that around 70% of their student population is immigrant communities. And what the census data is showing us is 26%. And so those are very different numbers. So there's a lot of work that I'm really excited about, but also, there's a very real fact that I am a white woman coming into these immigrant communities. And so for me, it's making sure that Kansas Appleseed isn't parachuting into the communities and doing organizing, and instead is going to the community leaders and organizations that already exist, are already reaching impacted communities, and letting them lead the conversation. Just for me, the anti-hunger summits will just be me organizing a space to let the actual experts lead the conversation.
It's a wonderful point. That's exactly how I feel about this panel. So thank you. Erica, what ways is your day-to-day work engaging those needs in the communities you work in?
Yeah, so the Rural Grocery Initiative and the Kansas Healthy Food Initiative, both of those programs are really working on the level of the built environment to either sustain or create more food access points at the retail level. So with the Rural Grocery Initiative, we are trying to help grocers and communities overcome challenges because the grocery industry is very difficult. So those challenges include grocery stores having a very low profit margin, having very high operating costs. Locally owned grocery stores face a lot of competition from dollar stores and large chain supermarkets. So our office actually tracked rural grocery store closures between 2008 and 2015, and we were looking at communities of 2,500 people or less. And between that 10-year period, 105 rural grocery stores closed during that time, and about half of them did not reopen. So this is just, when those grocery stores close, this is just creating more barriers to food access. So we really try to be a resource for rural grocers. We provide technical assistance. Sometimes grocers are needing resources related to e-commerce, or they're wondering how to add more local produce in their store. We have helped grocers navigate the process of becoming a. We've tried to strategize, increasing profit margins. So, and a lot of the times we are working with communities that have lost a grocery store and they want to bring one back. So we are also helping them think through what their options are. So overall, with the Rural Grocery Initiative, I would say in a nutshell, we are providing information and tools. And if we don't have the answers, we are trying to connect them with people who do. So we're kind of this networker for them as well. and just trying to do as much as we can to set them up for success. And then with the Kansas Healthy Food Initiative, we also provide technical assistance, but as I said earlier, we have a financing component. So we are also providing capital to help sustain existing food retail access points or create new ones. And we do this through loans and grants. So for instance, funding from KHFI could go toward opening or renovating a grocery store. It could be used to help with food distribution. It could be used for technology upgrades or purchasing equipment. So just trying to help those entrepreneurs overcome those financial barriers so that they can be serving the community. And I think that this is really a way of using and building up the assets that are already existing in a community to help them sustain food access over the long term.
Thank you. Kendra?
Yeah. Wow, it's incredible to hear each of you guys say some of those things, because it's really neat to hear that. I think part of my social work background also recognizes that people are experts of their own lives, really listening to what they want because they know what they need. I think, Martha, you gave really great examples of really including people in that. I think one example locally here, our hospital had some extra ground near them, so they planted a huge community garden with the intention of donating all of their produce to our local food shelf. And they grew a lot of kale. And the thing I heard from many, many families was they didn't know how to use it. So once they got it in their food box, they threw it away. And the next year, the hospital, they said, okay, we won't grow kale again. And the next year, they grew spaghetti squash, which I don't know how many of you have ever cooked spaghetti squash, but it's kind of hard to learn and really know what to do with it. So people started saying, if you're going to give us these foods, maybe give other ingredients that could be paired with them. So if you're making spaghetti squash, also include tomatoes for tomato sauce, include a recipe, or they started offering cooking classes so they knew how to use that produce. And then they actually just started saying, well, what foods do you want us to grow, right? So really including them and letting them be part of that process. And now it's mostly tomatoes and cucumbers, the foods that I think are most ready to eat or ready to use for families. And I think that's a really great example of what really including our customers or our clients or our community in doing. Some other things that we've heard from our office work that we're doing is people saying they wish that they could grow some of their own food. And working with a population with lower income, a lot of them rent, so they don't own the land where they're staying, or their landlord won't let them grow things. So then we talk about community gardens and what it looks like to grow food in a community. But in our community in Newton, we don't have a community garden except for one that's on the very edge of town, like edge enough that it's a separate community in North Newton. So for people who don't have transportation, it's not feasible to walk 45 minutes to get to a garden and then walk back. So we started an initiative to help people plant gardens on their front porch or just in pots, so container gardens. And this spring we hosted several different classes, and we were able to give out maybe 200 different tomato plants or herbs or whatever for people to grow on their own. And we encouraged them to put them on their front porch, so you see them every day, then you remember to water them. But then you can also see your neighbor's tomato plant and see it grow. And then it's an extra point of connection or a way that you can relate to them. And that's been really meaningful this spring, because it's hard sometimes, like that small talk. When you pass your neighbor on the sidewalk, you say hi, maybe you just walk past them or don't connect. But just adding that kind of intentional point of connection has been really powerful here. And then one other thing that I'm very excited about as people talk about growing gardens and the initial cost of planting them, we partnered with our local library to have a seed catalog. So now anyone who has a library card can go and just check out seeds, and they can plant them and grow whatever that is. So that's, I think, just one more point of connection. So, yeah.
Wow. I live in the same county. I didn't know about all those things. That's awesome. Thank you. I'm curious, hunger, food access has definitely come out as a big need in communities. I'm curious if there are other maybe related, unrelated issues that communities are facing that maybe aren't as obvious, that would be good to bring out and highlight. We know, I think overall in the state, access to affordable childcare is a tough one. In certain places, broadband access is a tough one. Stigma, obviously, with mental health services and things like that. But I'm curious if anybody has any thoughts, and I might just open this one up to whoever wants to answer. What is something that you see in the community around you or places that you visit and work that is kind of a hidden issue that addressing would help improve the health of the community?
Well, I can talk for a little bit on it. I think, because my background is in domestic violence, that's a very hidden struggle. The work that we did, everyone I worked with was confidential, that even if the police came and asked about someone, we would tell them, I can either confirm or deny anything about this person. And so it's such a hidden issue that interacted with every single issue on the map. So it interacted with, a lack of affordable childcare, interacted with the judicial system, and interacted with rehabilitation and substance misuse. It interacted with housing, absolutely. And in all of these situations, access to any resource was dangerous and required a lot of safety planning. And so I think, hunger is and food insecurity and everything Erica was saying can be such taboo phrases that lose meaning sometimes. But I think what we've heard from this panel is that hunger is a racial justice issue, an economic issue that intersects with everything across the board. Keisha said, if, you have, you said like, if you have food, then you're happy, it's like there's so much that food contributes to, and having access to food would increase your capacity to access mental health services. People are making decisions between food or medicine, food or keeping my lights on, food or having gas to go to work. Those aren't decisions that people should be making. Food is a basic necessity, and we call ourselves the breadbasket of the country. And yet there's, Eric had talked about, most of the state is shaded with food deserts. So I think when we address hunger, we address other issues as well. And there are organizations in Southwest Kansas that, for immigrant communities and particularly people who are undocumented, that, everyone is hoping to increase the relevance and voice of these communities, but they can't civically engage in voter engagement or census work or anything until we build safety, but also they can't civically engage until they have access to food. So I think that it just intersects with so much, that this is like a baseline issue that once, hopefully it can be solved, then we can actually give priority to so many of the others that intersect with it and sometimes get pushed to the side.
Yeah, and I would echo everything that Martha just said. And I would also add that I think one of the reasons why those issues are less seen is because the consequences associated with lack of food access build up over time in our own lives, in our communities, in very gradual and insidious ways. So, for instance, if we had equitable access to healthy food, we wouldn't see such high numbers of non-communicable diseases like heart disease and diabetes. Another example is how locally owned rural grocery stores keep dollars circulating within our communities. So what happens when that grocery store closes? Let's say they had a dollar store move in and they couldn't compete. What happens to the dollars that were circulating? They're gone now. What happens to the jobs? They're gone. So yeah, I think that it's food access, or the consequences associated with the lack of food access. They're not like this immediate concrete thing that you can just see. It's changes in our health and in our communities over time. And that's kind of what makes it so challenging to address too.
And you had asked what are some of the other bigger issues coming out of crisis, and working with the suicide prevention hotline and being one of the people on the other end of the line that answers those calls. The suicide rate for our farmers and for their families, and it is just and also being a first responder, it really opened my eyes to how much food is like the center focal point, and you have all of these branches that branch out from just the need and the necessity of food, growing food, providing food, having the access to food, what food does, how it affects the family, how it affects the farmer, his confidence, his ego, his determination, who he is or who she is as a producer for the community. I know when my grandfather, when he had our family farm, when he was living, people came to our farm just to come and pick greens, just to come and, socialize and just get out and just be a part of the community. And people just did that for free. So food is such a focal point that if we do not get it, if we don't get it together as communities, as people that have the capacity to make these changes, it's really going to be devastating, even more devastating than it is already now, for our seniors, for our youth, for our farmers. We just have to find some connecting solution with all of the smart brains we have on this panel and all the people we have connected to this Zoom. We can come up with something. And I believe we can come up with something to help the farmer, help the community, help the school system, help everybody that is needing a food solution.
Wow, it's incredible to hear all three of you talk about those things. I wish I was as articulate as you are in saying some of those things, but they're really powerful. I know for me, my grandparents used to have a greenhouse and they sold flowers, and they were on our main street here in Newton. And that is right where the railroad crossing is on Main Street. And for those of you who know Newton, that right now is contaminated soil. The city has said we won't build here for 15 years because it's so polluted from the diesel spills from all of the trains passing. And to know that just in the past 40 years, it was like lush, green, growing land. And now won't be that for a generation. What that looks like to lose is sad. And I think that's a common problem. I think hearing all of these stories here too helps increase our creativity. I know one thing that's really stuck out to me when I ask people about their lived experience and how they navigate the community. One of the questions I ask is, tell me like your favorite part about Newton. Why do you love this community? Or if you love it, what's the thing you tell people about? And it's very weird. The thing that I keep hearing about is a convenience store that's right in our downtown, because it's the only place where a lot of them can get a drink if it's too hot, where they can get cigarettes that are accessible. but also the lady who owns it lets people buy things on credit. So if they can't afford things kind of towards the end of the month, she says it's okay, and they'll just come back a couple days later and pay. And it's such maybe an outdated model, but also it's a creative model that helps people get the things that they need. And I think we need a lot more of that creativity in our community. And I think creativity solves a lot of problems. I mean,
And
there's
I
a
think
whole lot of
like expanding our definition of mutual aid to that, right?
Mhm.
Like that convenience store owner is a mutual aid provider, and that commerce and can be included in mutual aid's definition.
Yeah, exactly. I think housing is also a huge issue, and I could talk about that for another hour, but yeah, I might leave that there and let you guys talk too. But it's neat to hear all of your ideas.
I don't want to get in the way of the great conversation. I'm curious, when you look at your community or other communities around you, what are some successes you're seeing, or either with the work that you're doing or other groups coming together to like make a positive difference? Just as kind of some final thoughts here before we take some questions. Yeah, what are some successes? What are some of the good things out there happening that you're excited about that maybe don't get told as much because that's how the news works, right? So, Keisha.
Successes. I spoke a little bit about it earlier with working with Sedgwick County in their youth program. And hopefully it'll just continue, and youth will be able to continue to work and understand the importance of food, where it grows, where it comes from, what it tastes like before it's processed and all the additives and everything are added to it, and then it's put in a little package to be in the freezer. Another success, our seniors they have gotten their senior vouchers. So our seniors get senior vouchers in order to use at the farmer's market. That's a success. They don't have to use their budgeted out allocated monthly funds. They're also using their SNAP. So our SNAP, we do buy one, get one free for the farmer's market. So they're utilizing those, which is awesome. And they're just getting fed. They're contacting us more. We're getting more out in the community. They are knowing that there is more fresh produce and fruits and vegetables being provided to them. So yeah, we have a lot of good successes and huge successes. We're thankful.
That's great. Thank you. Martha?
Yeah, actually, I just have a follow-up question for Keisha. Is that SNAP program the double up food bucks for?
Yes.
And it's been successful?
Yes, it's very successful. I think it needs to be amplified more so they can know that you can use these. So you get so the double up food bucks, if those of you that don't know, they can use their SNAP EBT cards, food stamps at any farmer's market, and they get buy one, get one. So if they spend $30, they only have to pay for 15 because they get buy one, get one free. But it has been very successful for the seniors and for those that qualify and are approved for the SNAP program.
I think that's really good to hear. Someone who works for that program has reached out to me for the farmers markets here. And I think it continues to do what Erica said, is bring money back into the community. And so, yeah, I think I would love to connect with you on that to chat about it. But for us, successes are kind of a little bit broader from what Keisha touched on, is just the PEBT benefits that have been coming in. We've done a lot of advocacy around continuing those programs, and now legislatively we're doing a lot of groundwork to make sure that those continue, that it's not just a pandemic benefit, but that those benefits can happen for, not just pandemic related school closures, but for winter break, which is a couple weeks long, that people should be reimbursed for the meals that are missed there as well, for snow days and other school closure holidays, as well as just continuing it in the summer. So, and then I think part of our advocacy too is making sure that those programs happen in a more timely manner, that people are getting reimbursed for those days missed. Because what happened in Kansas is that for the 2020 to 2021 school year, the pandemic, the PEBT funds didn't come until the middle of summer and are still being distributed now. And then the summer PEBT is going to be distributed in the fall, and that's not when families need it. So again, centering the experience of impacted community members is huge. But continuing the PEBT benefits has been a huge success, as well as offering universal free meals to all kids in schools. That's what the pandemic has offered us. And across the board, this is a nonpartisan success, and one that, we're taking up to the federal level to just mandate. And we saw that California mandated it, and Maine has as well. And the community is celebrating because, I think when I talk with other organizations, the in for every single person and community member and legislator is children. And so, for food, if we're feeding our children, and that is a universal right, and that there's no meal shaming, and then from there we can build the nutrition of what those universal free meals contain, then that's a huge success and boosts it. And it's that empowerment model. We're empowering all these kids to be involved in this program and lessen the stigma around it. So I think that's been a huge success that Kansas Appleseed has helped contribute to.
Amazing. Thank you, Martha. Erica, successes for you in your work or that you see happening around you?
Yeah, so in my work, I have seen many bright spots across Kansas, where communities are actually coming together to re-envision their relationship to their local grocery store and what the local grocery store means for their community. So some of these communities that I work with had lost their grocery store. Some of them were at risk of losing their local grocery store. So community members rallied together and realized that they had a stake in this issue, and that they decided they were going to work together to support having a grocery store in town. So we have numerous examples across Kansas, many of them, if not most of them, in communities of less than 1,000 people, where they are using innovative community-supported grocery ownership models that are not your typical independent operator. And I think this really relates to something that Kendra said earlier about being creative to come up with these different solutions and being willing to think outside the box and come together to work together. So some of these models, community-supported models that we've seen across Kansas include cooperatives. We have seen nonprofit grocery stores. We have seen public-private partnerships where maybe a public entity owns part of the grocery store, and then there's still a private business owner who owns a different part and still manages and operates the grocery store. We've seen municipally owned grocery stores, school-based grocery stores, and all of these models are in rural Kansas. So that just really cheers me to see that communities are being willing to work together and put some skin in the game for something that is so fundamental and so important for communities to thrive.
What I hear all of you saying is like the importance of taking a hands-on approach to really like control the narrative, or to really put yourself out into your community and do the work. And I think that's really important. I know in Newton, this summer was the first time we were able to offer the Double Up Food Bucks program. And maybe the third or fourth week into the summer market, a donor, a person with some large amounts of money, went to the market coordinator and said, I see this as a success. If people use this, I want to see it grow too. And starting next week through the end of the summer, they'll actually get triple up food bucks if they go to our farmers market. So if you would spend $25 on your EBT card for produce, they'll get $75 worth. And that's like an example of one individual making an impact. And obviously we can't all make that same kind of impact, but on a different scale. So one story that I really like, if I can share two examples. I asked one man in our community how he supports his neighbors, or if he knows his neighbors. And he said every day when he's done reading his newspaper, he throws it over his fence for his neighbor to read. And I mean, he could recycle it, he could throw it away, but it doesn't cost anything extra. And that's how he builds that relationship. So I asked the neighbor what he does with the newspaper. And he said when he's done with it, he throws it over his fence. And I found 6 families that read that one newspaper. And then I was able to take that story back to the first man, the one who pays for it, and tell him. And he didn't understand like the breadth of his, his little act and how far that reached. And I think that's a really good example of what it takes each of us just investing a little bit in different places, and then the collective impact we could have.
That's great. That's awesome. I love that story. Well, yeah, thank you all again. If anyone has any final thoughts or something important that you want to say, I'd say go for it. Otherwise, we'll take some questions here. Barring that. Okay. We have a question from Zach. Zach, do you want to ask your own question, or should I ask it for you?
I can ask it. Thinking about farmers or people, you ask them what's going on and what's bothering them, what they're thinking about. And especially with farmers, you could probably guess weather, right? Are we getting enough rain for the crops? We got a storm coming in, all that stuff. Sure, we could use some rain. I'm wondering, have in your work, in your experience, have you encountered any mental stresses that come with extreme weather? I know the tornado got brought up, climate change and how that's affecting people in the community, especially as it's their hope for the future, maybe a cloud overhead. Because that directly affects food access, right? If we can't grow the food.
Yeah, I might jump in real quick and then let someone else answer. The thing that I understand about the tornado when I grew up is that everyone experienced the collective trauma. Like everyone had a really hard time. And because everyone had that same kind of experience, it was easier to talk about. Whereas if you talk about domestic violence or things that's only happening to you, it's harder to relate to other people. And that might be the silver lining of the pandemic, is that it's a collective trauma for everyone. We're all experiencing this need to pull in tighter. And I think that actually makes it easier to talk about some of those like mental health stresses then, because it's kind of a broad blanket for everyone.
Got another question here asking, how do you get people to return to caring about their neighbors? Our community is divided by the haves and have-nots, and it seems that the have-nots do not care about, or the haves do not care about the have-nots in regards to maintaining the grocery store in the community or helping the economically disadvantaged gain access to food. So I guess on a wealth disparity, that's a pretty big one to tackle. I don't know that.
Yeah, it's a good question. I'm happy for anyone else to jump in there too. I think it's really hard. I think initially it's starting with relationships with those closest to you. If you make cookies, take a couple over to your neighbors. If you have extra tomatoes growing, take them over. I'm personally really intentional about spending time in my front yard so I can see people when they walk past. For a lot of people, if you have a dog or if you have a kid, it's easier to have like that point of connection. I think it's just really investing where you are and then growing out. But for the haves and have-nots, I think a lot of it is education and saying we're all in this together. A rising tide lifts all boats. But how you do that, I think it's hard. It is. And that's probably the only answer I have for that.
Yeah, I think Kendra brings up a really good point with education. I think that Southwest Kansas is or wants to be a more close-knit community that takes care of itself. And in some ways that happens, but in other ways there are huge disparities and separation just based on where people live in town and what your cultural identity is, what your orientation, your sexual gender orientation is, and how that looks in a rural community that has been consistently white. And now it's not anymore. And so I think for Southwest Kansas, there needs to be an acknowledgement that white people are the minority, and that when we're talking about taking care of our neighbors, we're taking care of all of our neighbors. And that when we're connecting with our neighbors, we're doing it in a way that's safest for them and not for us. I think that Southwest Kansas has a lot of work to do to be accountable. And I think this goes to, Ryan, you had sent out the last question of a vision of building healthy communities. I think that there's a lot of organizations here that are doing amazing work, and I want to make sure that their work is amplified. And then there's organizations that aren't doing as amazing work because they're not being actively anti-racist and intersectional in their work. And I think that's being brought to people's attention more now. I think that for Kansas Appleseed, we work a lot with government organizations. And so it's balancing being a community partner with government organizations. But really my priority is being a community partner and advocate for the impacted community members. And I think, it's hard because you have to build a relationship with government organizations so that you're heard. But I don't think that should diminish prioritizing what I'm hearing from the community. So I think that taking care of your neighbors is making sure that you are centering their experience and doing everything that Kendra said as well. And I think Southwest Kansas has this mentality that they're there, but they're not. And I think that the immigrant communities, from what I'm hearing, do care for their neighbors and stuff. I think it takes people from outside those communities also being caring neighbors to really make a huge impact.
Thank you again so much to all of our panelists. Thinking about amplifying, like you were saying, Martha, the good work the organizations are doing. That's exactly what I was hoping would happen here, and I think it really did. So I really appreciate everything all of you do. And so thank you.
Thank you all. Have a good week.
Thanks, everyone.